introduce myself and my teammates. My name is Siti Nur Ain binti Mat Jamtu, and my teammate is Ahmad Nazif bin Azmi, and another one is Venisha Arjunan, Fasuntra anak perempuan Arumugam, and lastly is Sophie Wajidi bin Muhammad Fuzi. A biological hazard is infections occur when harmful biological agent such as bacteria, virus, fungi, or parasite invade the body, leading to disease and health issue. This infection can spread through direct contact, airborne transmissions, and contaminated surface or vectors like insects. And symptoms vary depending on the pathogen and can range from a mild to severe, including fever, respiratory issue, and gastrointestinal distress. Preventive measure like hygiene practice, vaccination, proper use of personal protective equipment, which is PPE, and essential to minimize the risk and spread of these infections.
Good morning, madam. My name is Vinisha Arjunan and my metric number is 423200881. Today, I want to talk about three causes and route of entry based on the article. The first article is dengue. Causes of dengue F3. The first one is climate condition. The combination of hot weather and sporadic rain creates ideal condition for Aedes mosquito breeding. Standing water from rain becomes breeding grounds and mosquitoes are more active during hot weather. The second one is human behavior and awareness. The public's lack of awareness and insufficient preventive measures contribute to the rise in the cases. People are advised to remove water containers, use insect killers, and take personal measures such as wearing appropriate clothing and using mosquito repellents. The last one is festive seasons and school holidays. The upcoming festive season and school holidays could facilitate the spread of dengue. Increased travel and gatherings during these times can lead to more mosquito bites and higher transmission rates of the dengue virus. The second article is about flu. The first cause in this article is seasonal peaks and year-round occurrence. The influenza season runs from May to July and November to January, which are influenza peak times. But since it can happen at any time of year, prevention and continual monitoring are required. The seasonal peaks contribute to the clustering of cases, especially in schools and kindergartens. Second is human behavior and preventive measures. The annual influenza vaccination, remaining at home while sick, covering the mouth and nose when coughing or sneezing, washing the hands often, and not sharing surfaces with others are all important public health measures that help to stop the spread of the virus. Increased rates of transmission may result from lapses in these procedures. The third one is population at risk and changing prevalence. Influenza is more common in some groups such as young children under 5, the elderly over 65, people with long-term medical disorders such as diabetes, asthma, or heart disease, pupils with compromised immune system such as cancer patients or those with HIV, caregivers, and healthcare professionals. Furthermore, the frequency of influenza cases might change by location and period, with certain areas having greater incidence of illness at particular times. The third article is about HIV. The first cause is sexual transmission. Since 2011, Sexual transmission has becomes the primary mode of HIV infection. In 2022, 60% of HIV infection were due to sexual relation. The second one is insufficient rate of decrease in new infection. While Malaysia succeeded in lowering new infection significantly between 2000 and 2009, the rate of decrease has slowed down between 2010 and 2022, indicating challenges in sustaining the momentum needed to further reduce new cases. The third cause is high risk behavior among youths. The article mentioned the importance of increasing awareness among youths to avoid high risk activities. The high prevalence of HIV infection among individuals aged 20 to 39, with over 90% being males, underscores the role of high risk behavior in this age of group in contributing of the spread of HIV. Now I'm going to talk about route of entry about article 1, which is dengue. Route of entry F4, the first one is inhalation. Although inhalation is not the main way that the dengue virus spreads, it is important to consider when using pesticides. It's common advice to use aerosol pesticides to kill mosquitoes indoors. When using these products, inhalation of the chemicals can occur, hence it important to use them in well ventilated areas and follow safety instruction. The second one is indication. Indication is not a direct route of for the transmission of the dengue. However, it is crucial to prevent the accidental ingestion of insecticides and other chemicals used to control mosquito population. Ensuring that food and water are not contaminated with these chemicals is vital for the safety. The third one is injection. The most relevant route of entry for the dengue is injection through the bite of an infected Aedes mosquito. The mosquito injects the dengue virus into the bloodstream when it bites a human. Preventive measures include using mosquito repellent, wearing protective clothing, and avoiding mosquito bite times early morning and evening. The fourth one is absorption through skin and eyes. While the dengue virus itself is not transmitted through skin absorption, the use of insect repellents and insecticides can involve skin and eye exposure. It is important to follow the application guidelines for repellents to avoid irritation or adverse reaction. Protective measures should include using repellents on exposed skin and ensuring insecticides do not come into contact with eye and skin. The second article is flu. The route of entry in this article is the first one is inhalation. Influenza viruses primarily spread through inhalation when an infected person coughs, sneezes, or talks. Droplets containing the virus can be inhaled by others, leading to infection. This is the main route of entry for the flu virus. Second one is inhalation. While inhalation is not a direct route for influenza transmission, it can occur indirectly. For example, if a person touches a surface contaminated with the virus, then touches their mouth, they may ingest the virus. This highlights the importance of good hand hygiene to prevent the spread of the virus. The third one is injection. Injection is not relevant to the transmission of influenza. However, it is pertinent in the context of vaccination. The influenza vaccine, which is administered via injection, is the best way to prevent flu infection. The fourth one is absorption through the skin and eyes. The influenza virus can spread when a person touches contaminated surfaces and then touches their eyes, nose, or mouth. This emphasizes the need to avoid touching the face and to practice good hygiene such as washing hand regularly and disinfecting commonly touch surfaces. The last article is about HIV. Here got three route of entry, which is the first one is injection, sharing hypodermic needles while abusing drugs. This was recognized as a primary HIV transmission channel in the early stage of the AIDS epidemic. This means of transmission is classified as injection. The second one is incation. HIV transmission can occur when the blood from an HIV positive caregiver's mouth mixes with food while chewing and an infant eats it. The last one is absorption through skin and eyes. There's also a risk if blood from a person who has a detectable viral load comes into contact with the cut or broken skin, giving HIV a way through the skin and into someone's bloodstream. If blood gets onto skin that isn't broken, there is no risk. That's all from me, madam. Thank you.
Hi and good morning everyone, and thank you for joining us today. I will discuss about the evaluation facts report. Firstly, we are going to the article about the dengue. The Healthy Ministry of the Malaysia has reported a significant risk in dengue case in 2024. In just the first 5 weeks, they have 18,247 report cases, which represents significant 65.6% increase from the 11,127 cases in the same period last time. The spike also include the increase in dead a person, which 9 compared to 6 a previous year. The most affected area include the Selangor, Kuala Lumpur, Putrajaya, Negeri Sembilan, Perak, Penang, Pahang, Sabah, and lastly is Sarawak. With Selangor having the most spot about dengue, this increase partly due to festival season and school holiday, which a facility that spread of the diseases. As the main vector at this like the warmer climate with a sporadic shower, inside the resplendent protective equipment and the removal the standing water, these are example for the proactive measure. Next, we are going to the influenza. Influenza cases in this article have decreased significantly from the January to July 2023. They have 158 clusters, down from 255 in 2022. School and kindergarten will have the most affected. Despite this article, influenza remains a serious concern. Preventive measures such as annual vaccination, proper hygiene, and avoiding close contact when the symptomatic are clear. The flu season in Malaysia typically peak from the May to July and November to January, with the high-risk group including the youngest, the oldest, and those with chronic illness. Lastly, we are going to the HIV. This article is show increase the new HIV infection is another major concern. Malaysia has recorded an average of the 8 new HIV cases daily and totaling around the 3,000 new cases each year. In addition, there was 50% reduction the new infection from the 2000 to 2009 and declined the rate slowly to 24% from the 2010 to 2022. Sexual transmission is now the leading the causes, particularly affect the individual from age 20 to 39, and to address this case, the Healthy Ministry launched the name PREP Government 2023 initiative providing pre-exposure prophylaxis to prevent the HIV transmission. In addition, efforts are being made to raise awareness, encourage regular screening, and promote early antiretroviral treatment. That's all for me. Thank you very much. I will pass the next presenter.
Assalamualaikum warahmatullahi wabarakatuh. Assalamualaikum warahmatullahi wabarakatuh. And next is control measure. What is control measure? Control measure is action that can be taken to reduce potential of exposure of the hazard, or control measure to that could be remove hazard, or control measure include action that can be taken to reduce the potential of reduce the likelihood of the risk of the exposure to the hazard being realized. So first of the control measures that can be used to reduce biological hazard is hygiene practices. What is hygiene practices? Hygiene practices is personal hygiene, refer to the regularly washing part of your body, using soap and water, including washing your hand and feet and parts of your body. So based on an article about HIV, the HIV article can be related to these practices, because these practices can use to reduce the cases and prevent from the HIV, because personal hygiene practices access to safe drinking water, sanitation and hygiene wash is essential for 33 million people worldwide living with HIV and AIDS. People living with HIV have rates of diarrheal disease up to 6 times higher than those who are not infected. So from that, it can prevent the HIV to those who are not infected, and can reduce the cases. What are the example of the hygiene practices? Is first, hand hygiene, which is encourage frequent and thorough hand washing with soap and water, especially after handling biological materials. Next is decontamination, which is establish procedures for cleaning and disinfection of surfaces and equipment, which is after using something, you must clean that thing, and to prevent from any potential hazard such as biological hazard. And next we go to the second ways control measures to reduce biological hazards. First, the second way is vaccination and health surveillance. What is vaccination and health surveillance? This control is immunization safety surveillance system for ensuring immunization safety through detecting, reporting, investigating, and responding to the hazards. So based on article about influenza, this control can be implemented to reduce this case. Influenza surveillance can be conducted through passive, active, and sentinel surveillance method. So first, passive surveillance is the routine collection of data from the fixed sites, such as outpatient wards and hospitals. Next, active surveillance. Active surveillance is the collection of reported cases that are reported to health authorities. These reports can come from hospitals and the community. And the last one is sentinel surveillance. Sentinel surveillance is a network of purpose-built reporting sites where more detailed information and samples are collected from people that fit the surveillance criteria. And sentinel surveillance can be supplement existing passive systems with more detailed information without overburdening existing national disease surveillance systems. From that, the vaccination can be implemented to all people to prevent from the disease. So what are example of vaccination and health surveillance? First is immunization. So what is this? Immunization is offer vaccinations against relevant pathogens to at-risk personnel. So for example, if we have the influenza, so to prevent from that is we take a vaccination, so we can prevent from getting the disease. And next is health monitoring. Health monitoring is implement regular health checks for early detection of infection or adverse health effects. If we, for example, uh, if we get if we have potential effects, that can be detect, we must go checks our health, and so we can know if we get or So the last one is environment controls. What is environment controls? Environment controls is engineering and administrative control solutions to minimize hazard exposure to inhalation, skin, eye contact, ingestion and injection. Based on an article about dengue cases that increased 60% in Malaysia, this type of control can help to reduce the cases and prevent from that. For example, we can use vector control to remove or eliminate the cause of the dengue by using like long-lasting insecticidal nets and indoor residual spraying, and also disinfection to prevent dengue cases keep increasing and maintain clean environment. So what is example of environment control? First, just like I said, vector control. What is vector control? Vector control is implement measures to control pests like insects and rodents that may transmit biological hazards. So, if we use the vector control, we can prevent from the hazard to being increases. Yeah. And next is disinfection. What is disinfection? Disinfection is use appropriate disinfectants and procedures to maintain a clean environment. So using this disinfection, we can maintain our environment clean, and from that we can prevent from any potential biological hazard.
Good morning, my name is Vasuntra Armugam. Today I am talking about Act Regulation Order section that cover the biological hazard that we have chosen to relate with the article at Malaysia. The first article is dengue. In Malaysia, the control and management of dengue fever are covered under several legal frameworks and regulations aimed at public health and disease prevention. Here are the key acts and regulations relevant to dengue control above this article. Primary Legislation of Prevention and Control of Infection Disease Act 1988, Act 342. These are the sections. Section 8 allows Minister of Health to make regulations for the control and prevention of infection disease including dengue fever. Section 11, this section provides for the enforcement of measures necessary to control the spread of infection disease such as fumigation and other vector control measures. This law ensures safe and efficient methods of controlling mosquito populations by regulating the use of pesticides and other chemicals in vector management. The second article is about influenza. Primary Legislation of Prevention and Control of Infection Disease Act 1988, Act 342. The sections are Section 10, Notification of Infection Disease including influenza. Medical practitioners are required to report cases of influenza to the health authorities. Section 11, Powers of the Minister of Health to make regulations for the prevention and control of infection disease, including measures specific to influenza. The framework for handling offences connected to the non-compliance of measures for the management of infection disease such as influenza is provided by these regulations. The third article is about HIV/AIDS. The structure for dealing with offences pertaining to the disregard of measures aimed at controlling contagious diseases such as HIV/AIDS is established by these rules. HIV and AIDS prevention and control guidelines released by the Ministry of Health offer true plans for HIV/AIDS surveillance, prevention and control. They consist of testing, counseling, treatment and public health education process. That's it from me. Thank you. The conclusion of the biological hazard is, as the world continues to face challenges such as emerging infection disease and antibiotic resistant pathogens, and the importance of proactive and robust biohazard management cannot be overstated. Through monitoring, timely response, and sustained commitment to biohazard safety, we can reduce the risk and protect the well-being of populations globally. That's it from all of us. Thank you so much.